Hello, everyone, and welcome. We're so excited to have you join us today. I'm Kara Tibby, manager for the Lifestyle Medicine practice and your moderator for today's Plant Powered Challenge session. We're so glad you're here as you continue exploring ways to nourish your body and mind through plant-powered living. Today's session is titled Nutrients, Your Foods Are Your Vitamins, and we're thrilled to have our very own Corewell Health lifestyle medicine physician, Dr. Nicholas Stephanoff, presenting today with us. Let me tell you a little bit about Dr. Stephanoff. He's a medical doctor who practices family and lifestyle medicine. He was on the small team that helped to launch our first lifestyle clinic in the country here at Corewell Health. And Dr. Stephanoff is the site lead for teaching lifestyle medicine to new doctors at Corewell Health. Dr. Nick went to school at U of D Jesuit, then Case Western Reserve for engineering, and Wayne State University for medicine. After he discovered the incredible impact that food has on health, Dr. Nick learned to love the good feeling that comes after eating a highly nutritious meal, and he wants to share that experience with his patients every day. With that, I'll hand it over to Dr. Stephanoff to get us started. Can't wait to hear your presentation.
Well, thank you, Kara, for that lovely introduction. It's so nice to be here with you all. Let me start with a story about a patient I take care of. We'll call him Kay, and he's a middle-aged gentleman with autoimmune disease, which means his body attacks itself, and is particularly active in his eyes. So turns out eyes are pretty useful, and therefore we were controlling his condition pretty aggressively, his eye doctor and I. And we'd give him steroid eye drops, steroid pills. Now, steroids are a strong medicine that lowers inflammation and calms down the immune system. And it works great for that, but it has bad side effects. Promotes diabetes and weight gain, affects mood. So he was pretty eager to do whatever he could with less drugs. And lo and behold, he took my advice about eating healthier food, and his autoimmune disease improved. Milder symptoms, less frequent flare-ups, needing them less often. And so I was delighted. He was especially delighted when I saw him recently for a physical, and he reported to me that he had not had a flare-up all year, and he felt great. And so that was something to really celebrate. The only thing we could attribute it to was his healthy food. And so there are a couple of things I want to bring to you today in the course of our discussion. One is, if you have illness or inflammation, I want this Plant Powered Challenge to be your opportunity to treat, control, maybe even reverse some of the illness you have just with your healthy food. And two, as Kara hinted at, I want you to have what I have when it comes to healthy food, which is excitement, eagerness to eat the healthy food, and this good feeling you can have after your healthy meal. You can feel good about yourself and the food you ate. And so I want to engage your mind. I want to give you knowledge to think about and even imagine the nutrients in your food that are going to make you healthier, and that you can be very happy to include in your diet. So what makes food healthy? There are kind of two sides to this coin. And if you want to come back some other time, and I'll tell you about all the bad stuff that makes meat and processed foods unhealthy. Today we're going to focus on the positive. So I want to talk to you about fiber, antioxidants, vitamins, minerals, and so forth. The stuff that makes the nutritious food particularly good for you. And first off, I thought it would be good to contrast the micronutrients to the macros, like what makes a nutrient micro or macro, yeah? You probably have heard of protein, fat, and carbs. And what makes them macronutrients is they all provide calories, which is to say our body can take protein, fat, and carbs and turn them into ATP, which is a molecule that basically fuels our cellular machinery. Now we know when we get more calories than we're going to use, what's our body going to do with these calories, with these macronutrients? They'll either be wasted or stored, which is to say added to your body as fat. So I thought it would be fun to pose a question to our group. I want you to answer this question out loud at home, okay? So here it is. What do you think is the healthiest nutrient for humans? Okay, so I think if we ask the average person, what's the healthiest nutrient, they'll say, protein, bro. Need protein. And I mean, that's partly true. You should get enough protein. Protein is healthy in the right amounts, but you know what happens to too much protein? We'll take a look. Protein's a macro. Too much protein gives you too much calories, and then it just gets ended up stored as body fat. I liked to answer this like a trick question. So I said, well, you can live for several weeks without macronutrients, but you can only live for several days, maybe if that, without water. And how about oxygen? We can't live for several minutes without oxygen. So I liked oxygen, but then my wife came up with an even better answer. I said, Sybil, what do you think is the most important nutrient for humans? She said, Nick, all of them are important. You need all the nutrients. And I thought, that's great. This is what I wanted to share with you for this discussion today, is you'll see all these different healthy micronutrients. And so you'll see like vitamin C is good, but we don't just need vitamin C, we need the other vitamins and the minerals, and we want antioxidants. And so two takeaways there is one, eating a variety of food. And we'll see a good variety of healthy food today and throughout this month. And two, you will get more of the nutrients from more nutrient-dense food, which is to say you want the food you eat to have lots of good stuff in it. So let's take a look at how we can conceptualize this. This table is the aggregate nutrient density index, and it is an attempt to take a food and sort of clump together all the good micronutrients, divided by the number of calories, because we should only have so many calories per day. And that kind of gives you a sense of how nutritiously healthy the food is. And so if you look at the left green column, basically you have the fruits and vegetables that are the most nutritious foods. In the middle, we have food that's like pretty healthy. And a lot of this will be the starchy base of your entree. And so you have potatoes and beans and oats and stuff like that. And in the rightmost column, you have foods that are less nutritious. And so you'll see here mostly animal products and processed foods. Now, there are other aspects to food that makes it more or less healthy. So for example, walnuts are high in omega-3s, which is good, but it's not a micronutrient, strictly speaking. So this is not a perfect conceptualization of healthy food, but it's a good one, especially for our talk today. All right, and when you apply that concept to a diet, you might come up with a diet that's high in superfoods. And so here's a scientific study using the GBOMS diet. That stands for greens, beans, onion, mushroom, berries, and seeds. This is a diet that is promoted by one of my favorite nutritional experts, Dr. Joel Fuhrman. His book, Eat to Live, that's what got me started off. And I lost my 50 pounds, got healthy. And so I love the GBOM diet. In this case, it was not mandated to, but simply taught to a group of employees who were obese, and they got tracked into this lifestyle program. And well, you can see what happened to it. And there are two things I want to point out about this study. One is that the superfood diet works really well because the folks who were on it improved their blood pressure, cholesterol, got off meds, lost a ton of weight. And two, it is the case that generally speaking, the doing is the hard part when it comes to healthy eating. And so being in a lifestyle program is generally what works the best. So that's why at the we wanted to make a lifestyle clinic that offers lifestyle programs to help people achieve the healthy living that gives them the good health. So let's dig into some of these micros. Yep. First off, I want to talk about fiber. And now We already had my favorite fiber expert, Dr. Bolsewicz, but I had to do fiber first because more than any other nutrient, probably, fiber is just like so well proven to promote human health. Like it's just really, really healthy. And what is fiber? Fiber is like a complex, long chain carbohydrate that is so big and complex that basically our bodies will not turn it into calories. Does that mean that the fiber just basically takes up space in our stomach and it's good because we eat less because we're full? Well, it does do that, but it does more too. Fiber is food for our probiotics. And of course, what I mean is not so much food for our probiotics, but foods for our microbiome, our bacteria, our healthy germs that are in and inside of our body. And so the bacteria that live in our intestines, we want good bacteria. Two, we want to give them healthy food that they will in turn reward us for. So when we eat plant food, our microbiome will take the fiber and turn it into stuff like butyrate, a short chain fatty acid that has been shown to help regulate our immune system. And that's the kind of thing that gets a patient like Kay to control their autoimmune disease with food. One quick story about fiber. So my family and I, we went to Mexico to visit my brother-in-law, and we kind of were sharing a cabana, and there was just one big electric pan that we could cook stuff in. And so my family would wake up early and we'd make oats or tofu or whatever. And then we'd hand it off to Alan's family and they'd be making bacon and eggs or steak or chicken tacos or whatever. And one day he said to me, Nick, I think steak must be the healthiest food because it's made out of meat and humans are basically made out of meat. So I think it has everything we need. I said, Alan, what about fiber? And so if it's not completely clear, fiber's in the plant food only. And that's one reason that it's so healthy for us. Let's take a look at some scientific studies on fiber. I like science. I hope you like science too. And what we have here is a massive combination of studies where researchers took all the data and put it together, and they said, what is the effect of fiber on health? This is over 100 million patient years, so really robust data. And if you look, you'll see the higher fiber groups did way better. And so let's compare, for example, a pretty high fiber consumption in the upper 30s versus like a kind of low. And just to give you a sense of how much fiber that is, the average American gets about 18 grams, and very healthy plant-based eater with a good appetite like me, I probably get over 50 grams easily. Those eating more fiber, they died significantly less, 15%, way less heart disease, less diabetes, less cancer, better weight, better blood sugar, better cholesterol, better blood pressure, healthy in almost every way, healthier. And these graphs, they show that that relationship. So on the left, we have death from all causes. On the right, death from heart disease. You start off at maybe 14 grams of fiber a day, and the more fiber people ate, the less they died overall and from heart attacks. That's the red and the blue lines showing that relationship. Now, one nice thing you want to see about science is you want your studies to be repeatable to show that it's fact, yeah? So let's take a look at another study, completely different one, also demonstrating this dose-dependent relationship where the more fiber, more better. And so in this one, we have 10 grams more fiber a day, 10% less death, 13% less heart disease, 10% less stroke, 10% less colon cancer. More fiber, more better. A couple other interesting studies I want to talk about when it comes to fiber, and then I'll give fiber a break for a little bit. So first off, if you know someone who is pregnant or looking to conceive, higher fiber will reduce preeclampsia. Preeclampsia being a very serious blood pressure problem that can happen in pregnancy. And it's worth noting that vegan mothers, they hardly ever get preeclampsia. Just look at the comparison to the general population, close to 1 in 1,000 versus close to 1 in 25. So fiber good at all ages of life, including pregnancy. Secondly, this other study I wanted to bring up because, so I'm a family doctor and I see patients for their physical pretty often. And if you had a physical, you probably had your cholesterol checked, and maybe it's been high because that's pretty common. And then the next question is often, well, is it time to take a statin or not? And so I have this conversation a lot, and it turns out some patients don't want to take a statin. They don't like to take lots of medications, and they ask me what else I can do. And so this is the study I tell them about. In this experimental scientific trial, subjects were randomized to kind of a generic American low-fat diet with like chicken and skim milk, or low-fat diet plus statin, or vegetarian diet with high-fiber foods like oats and beans and almonds. And what you see is the vegetarian diet did as well as the statin and lowered LDL like 30%. So that's a big drop in bad cholesterol. One takeaway from this study is I've seen 1,000 patients switch from red meat to chicken, and basically it doesn't work because it's not a big enough of a change. If someone really wants to lower their LDL a lot and improve their cholesterol, it takes a pretty, you got to really go significantly more plant-based to do it. But it can work. So next I want to talk about vitamins and minerals. This comes up sometimes in visits with my patients, that I will see someone who's just not feeling well, or maybe they're getting sick too much. And if we can find something missing in their diet and add it, sometimes they feel better. Or sometimes I'll test for their vitamin D or B12 or whatever. And lo and behold, it's low, and replacing it helps them feel better. So first, let's look at vitamins. I want to talk about vitamin C. This is a popular one for improving immunity, and it's also an antioxidant. And it's in a lot of different colorful foods. So eating your bell pepper, which makes a great snack, or strawberries, oranges, of course, broccoli, pineapple, cauliflower, all very healthy foods. And unlike the vitamin C supplements, which in most studies either don't work or barely work, the fruits and vegetables will give you better clinical outcomes with the vitamin C. Secondly, I want to mention folate. Folate's an interesting one. This is used in a lot of growth and new cells, and so it's particularly of importance for someone who's growing a baby inside of them. And folic acid was famously added to prenatal supplements to reduce spina bifida, and that actually helped. But there is some concern that too much folic acid can be harmful. And so you can either get, folic acid is a precursor for folate, so you can either get a better vitamin that has folate, or it's not hard to get folate in your healthy food if you eat the right foods. And so lentils, spinach, broccoli, peas, strawberries, greens, all very rich in folate. And you can think foliage is like leaf, well, eat your leafy greens and you'll get lots of folate. I put liver on here. I want to say something real quick about that, because I've had a handful of patients try the carnivore diet, and the meat is not very good in antioxidants, but organ meat is actually okay. And so I would challenge my carnivore eaters, if any happen to wander into the Plant Power Challenge here, why don't you eat some organ meat if you're not willing to eat some veggies? But I like veggies better. Next, B12. This is a nutrient of concern for us plant-based eaters because it's low in plant foods. And so this is something you probably want in your multivitamin. B12 is not that uncommon to see low. It's important for nerves and red blood cells. And it's also in some fortified foods. So it's in the soy milk that I add to my coffee, or the nutritional yeast that I put in some of my soups or salads. but you do want to make sure you get enough B12, especially if you're a plant-based eater. Vitamin D is just hard to get for everyone, whether you're a vegetarian or an omnivore. It really comes down to sunshine with the vitamin D. In fact, this will be interesting to you. You can get vitamin D from mushrooms, but only if the mushrooms were exposed to sunlight too. And most of the commercially grown mushrooms are grown in the dark, and so they're actually not a great source of vitamin D. So, so I get this in my multivitamin as well. As for the minerals, calcium comes up a lot in visits with patients, especially seniors where I'm checking their bone density. And this is one you can definitely get from your food alone. A lot of healthy foods are rich in calcium. Geez, broccoli's coming up again. We're going to see this one over and over. Soy stew, meaning like tofu or tempeh or edamame. Nuts are good in calcium and a lot of the minerals. Also, almonds are a good source of calcium. And in fact, let me just dispel this myth. You do not need to drink milk to get calcium. Since milk is a caloric beverage, it's kind of fattening. And if you look at a per calorie basis, the greens will have like 2 to 3 times more calcium content compared to milk. So just eat your greens. They're better for you anyways. Zinc, unlike calcium, is a little harder to absorb for us plant-based eaters. And there are good sources of zinc that you should be eating, like lentils and beans and nuts and seeds. But this is another one. So the problem with absorbing the minerals like zinc and iron is that there are some components in the plant foods that bond with the minerals and make it harder to absorb. So I like zinc in my multivitamin. My vegan multivitamin, I make sure it includes zinc, vitamin D, B12, and also iodine. So iodine is next, and this is mostly used for the thyroid hormones. And most Americans are getting it from their iodized salt. So the typical person eats too much salt, but at least they're getting their iodine. The problem is salt is bad for you in excess of whatever's in natural food. And so someone like me who eats mostly whole food, I have to be a little more careful about my iodine. Now, I would love to get it from the natural source, which is seaweed. So I should be eating more seaweed salads. And for a while, I was putting Icelandic kelp on some of my dishes. But in the end, I kind of just left it to my vitamin there for iodine. Finally, I want to address iron when it comes to minerals. Iron, you should know, is a major component of hemoglobin. Hemoglobin is in the red blood cells, and it carries oxygen to your organs. So if someone's low in iron, they will be anemic and they'll feel tired out. And this is not that unusual, especially if someone has bleeding. A plant-based eater can get enough iron from food unless they have some other problem, like a bleeding problem. But they have to be a little intentional about sources of iron. So take a look. This is one area where, oh, it's not, where's the broccoli for iron? I have here beans, tofu, and the whole grains. Whole grains are good sources of iron. And this is one reason your plant-based diet needs to be well-designed and well-balanced so you get all of the different nutrients you need, like my wife said. So eat a wide variety of foods, eat your beans and grains, don't neglect those, and you'll get some iron. And this is something that if you're a vegetarian or vegan and you have a bleeding problem or low levels, you might need an iron supplement as well. Okay. Next, I want to talk about the antioxidants. This is a cool category of nutrient. Antioxidants, anti the oxidant, which is to say, oxidation is, it's basically rusting. Rusting is literally oxidation of iron. And a similar process happens in our bodies. So when I was in med school doing my cadaver dissection on a 90-year-old, you'd look inside and you'd see all these brown tissues. And what that is, that's damage to the tissues, loss of elasticity and more stiffening, and the oxidative molecules, they damage DNA and promote cancer. And they come from additives in food, they come from spoiled fats. They come from pollutants and toxins in our environment. And what do we do about this toxic stuff that ages us? Well, we block it with the antioxidants. And so let me show you what's up with that. First off, let me tell you about the carotenoids. This is a very colorful family of antioxidants, as most of them are. And you will remember carotenoids and beta carotene because you get beta carotene in carrots. Carrots have beta carotene and they're orange. So it's the colorful orange antioxidant. Lycopene is a very red nutrient. And so you get that in your tomatoes, that you can see those delicious looking cherry tomatoes there. Will give you lots of lycopene, a very powerful antioxidant. I'll mention lutein and zeaxanthin for anyone that has an eye condition. Your eye doctor will often give you an eye vitamin. And you know what's in your eye vitamin? These antioxidants that you can also get from your colorful, healthy food. Another huge family of antioxidants are the polyphenols. And we'll talk more about flavonoids in a minute. I wanted to mention resveratrol. So resveratrol comes from grapes. It's a great antioxidant, and it made us think wine was healthy for a little bit until we remembered that alcohol is kind of unhealthy. But you can and should still get your resveratrol. I want you to get it from those nice purple crispy grapes up there in the corner. Resveratrol is rich in the skin of your colorful grapes, and so eat grapes. Flavonoids, we saw, are a subcategory of polyphenol, and there are some really excellent flavonoids. Anthocyanin is a powerful antioxidant that makes berries very colorful, so it's a red or purple colored nutrient. And the berries are big time superfoods because they're also very low in calorie density, very low sugar. They have all sorts of other good stuff in them too. You should eat lots of berries, and they taste good. Quercetin is an interesting antioxidant that has been suggested in improving longevity, and it lowers insulin, which is nice because insulin promotes the fatness and diabetes and aging. And there are all sorts of good flavonoids. And once again, it's the colorful foods. So what we see here is a rainbow of healthy foods. And that's when you hear something like eat the rainbow, the point is, one, eat your colorful foods because they're generally more nutritious. And two, eat your variety of foods so you get all the different nutrients you need. So let's take a look at a few scientific studies. I have one here on fruits and vegetables. And one reason I picked this is when I'm trying to get my patients to improve their healthy living, and I'm investigating their diet, the food they eat. Oftentimes, I'll notice like, oh, hey, you hardly eat any vegetables. You didn't mention a single vegetable. Why don't we eat a couple vegetables a day? And or maybe someone's having an unhealthy snack, and we can replace their cheese sticks with apples or something, or cucumber. And we'll take a look at this study. This followed senior women for several years, and what they noticed is those who were eating more fruits and vegetables, and it didn't even take that much, it was like 5 or 6 a day, they died half as often. So that's pretty good payoff. I wanted to highlight also how the antioxidants improve lung health, because it's easy to imagine these oxidizing pollutants and junk getting in our bodies and hurting our lungs and causing like asthma or COPD. And the antioxidants are well proven to prevent or even fix that problem. So this first study had horribly severe asthmatics in Scandinavia, more than 10 years of chronic asthma, so bad they were taking steroids every day so they could breathe. And they were put on a pretty high vegan antioxidant diet, and some of these studies, the researchers, they would draw blood and they would see like, oh yeah, they got high antioxidants in their blood. Anyways, the asthmatics put on this diet, just after a few months, most of them were better. And after the whole year, over 9 out of 10 improved lung function, which is FEV1, FVC, like how well does the air flow, how much of a breath can you take. how they were feeling, their symptoms, how they were looking on their blood tests, all better, 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 better. Another study looking at asthma. This one I'll show you a graph on soon. Those who ate a good amount of fruits and vegetables as opposed to like a low to medium-ish, half as many asthma exacerbations. And finally, another study looking at COPD, chronic obstructive pulmonary disease like emphysema or chronic bronchitis. Those who ate more fruits had less death. So that's nice. And I can tell you, looking into the study, it was particularly the case for those who were or had been smokers or even were exposed to secondhand smoke. The fruits were even more effective for those subjects. So here's the survival curve. This isn't for death, but for asthma exacerbation. So both groups start off at 100, and then someone has an asthma exacerbation, their group drops down a peg. And the dotted line is the low antioxidant, which was like a few fruits and vegetables a day. And the solid line is a high antioxidant, like whatever it was, 6 or 7 a day. And so those who ate more fruits and vegetables, half as often would they have an asthma exacerbation. And there you can see the difference. The rate is improved. A few more great nutrients I wanted to talk about. There's so many, but we're getting some good ones today. Sulforaphane is probably one of my top favorites. And guess what healthy food you get this puppy from? It's broccoli again. Broccoli, of course, is a cruciferous vegetable, meaning it's branching, cross-like. And so this whole category includes broccoli, cabbage, and Brussels sprouts, and the kale, and asparagus, and stuff like that. But anyways, broccoli is a great source of sulforaphane, a super potent anti-cancer, detoxing nutrient. And so if you're a plant-based beginner, for goodness sake, just eat some broccoli or cauliflower. But if you are a plant-based pro looking to up your game this month, I want you to optimize the broccoli by activating the sulforaphane with myrosinase. Myrosinase is an enzyme that is destroyed if it's cooked too much. And so listen, if you're having roasted broccoli or steamed broccoli, that's great. It's healthy. But to be a plant-based pro, we're going to save a couple of those florets and eat them raw before or with the cooked broccoli. And then you'll take your game to the next level. Allicin similarly is a super nutrient that is activated in the preparation of garlic. But it doesn't matter if it's cooked or not. This time, the problem is if you cook a whole clove of garlic in your oven or something, you're not getting the most out of it. You'd be better off mincing it up and putting it on your green beans or whatever. So allicin is a really great nutrient too that you'll get from garlic. Curcumin, some of you may have heard of. This is a famously strong anti-inflammatory nutrient. Curcumin is a nutrient found mainly in turmeric, which means it's going to be in seasonings like curry. And it is so strong, I'll show you in a second, it's as good as Aleve or as Voltaren, like a non-steroidal anti-inflammatory medication will be tied or beaten by curcumin. Finally, I want to mention nitric oxide because this is a nutrient of concern for anyone at risk or dealing with heart disease. My favorite cardiovascular expert, Dr. Esselstyn, who wrote Prevent and Reverse Heart Disease, he has his patients eat green vegetables 3 or 4 times a day to keep their nitric oxide levels up. Now, this is really interesting. The nitric oxide is not actually in the food. Nitric oxide is a chemical messenger our body makes if we give it the right stuff. And the right stuff is greens plus either vinegar or sunlight. And so if you have some greens with your meals, maybe a nice salad with your lunch and dinner, then you'll be having your nitric oxide levels boosted up, and it will open up your blood vessels. It'll make the lining of the blood vessels nice, smooth, and then you'll be very resistant to heart attack, stroke, aneurysm, dissection, all the terrible stuff that you don't want to suddenly die. Here's the curcumin study I promised you, folks. Let me break this down a little bit. We have 3 groups: curcumin alone, curcumin plus diclofenac, which is Voltaren, diclofenac alone. Small study, but the results were just so powerful that the p-values, which is to say the statistical significance, was like, this is not due to chance. This is the real deal. So look at this left column with the green oval. You see at baseline basically how sick they were, and the curcumin group actually started the sickest and ended the healthiest. So before starting curcumin, 18 painful joints per person. Afterwards, 3 EOTs, end of treatment. Swollen joints, 12 down to most of them don't even have a single swollen joint. How bad out of 100? From like 80 to 30, both in the opinion of the patient and their doctor. Disability, down from a score of 4.4, which is pretty high, to 1. So massive improvements in symptoms with a pretty big dose of curcumin. For cancer too, our superfoods are going to be really excellent. And this is such a cool study. I love to reference this one for folks asking me what they can do to prevent or to optimize their battle against cancer. So what researchers did here, the scientists, they took human cancer cells. Yes, these are human cancer cells, not some like mouse cell or something. They had all sorts of different types of cancer. This is breast cancer here. And they grew the cancer cells in the lab, and they put different foods in to see what would happen. And so the control you can see is like normal growth of the cancer cells without anything. And on the right side of the graph that's where the foods are that basically wipe the cancer out. And so like your bell peppers in the middle, that's great. That cut cancer growth down by half. But what you really want are the allium vegetables. Those are the yellow ones, garlic and onion basically, that wiped out the cancer cells. And your cruciferous vegetables, which I hope everyone remembers, broccoli is on that list. And you can see broccoli did great. Also cauliflower, cabbage, and Brussels sprouts, great anti-cancer superfoods that I want you all to eat more of. So let's review, because repetition is the mother of memory. We want vitamin C for your immune health. Eat your bell pepper, your orange, cherry. We should be eating cherries in Michigan here, right? Broccoli, pineapple, cauliflower. You want folate, especially if you're looking to have a baby. Well, eat your lentils, your spinach, your peas, your strawberries, all your greens. Calcium, once again, eat your greens, your broccoli, your different beans, almonds. For zinc, we want to have lentils and pumpkin seeds. Let's make some pumpkin seeds. Pistachios, cashews. Looking at the foods from a different angle here, we're remembering our G-bombs: greens, beans, onions, mushrooms, berries, seeds, our dark leafy greens, our different herbs and spices. And by the way, generally speaking, as long as we're not talking about salt, the seasonings are healthy. Cinnamon lowers blood sugar, and cumin has some health benefits. And what I'm trying to show here is I'm trying to help you think about and decide on and pick some of these healthy recipes that you're going to make and get excited about. Okay, so you're going to see these ingredients in your recipes, and you're going to want to make them because you'll be excited to eat this stuff. And maybe you're even going to add some extra garlic. Now I want to preempt some questions that you might have, and get you going with some practical advice about the nutritiousness of your food. So first off, sometimes the patient will ask me, all right, I'm trying out this new food. Well, should I get a fresh or frozen? And what about the canned beans or something? So here's the deal. The optimum nutritiousness of the food will be captured if you get it as fresh as possible. But it's not completely necessary. And over time, fresh produce does deteriorate somewhat. And so there's spoilage, and some of the vitamins and fiber will break down. And so fresh produce is great. It's super healthy, and fresher is better. Frozen can be just as good, especially if the fresh stuff is kind of meh. Frozen foods are generally picked at peak ripeness, and the flash freezing preserves the nutrition pretty well. And I eat lots of frozen berries in my smoothies or as a side. I eat lots of frozen veggies. I like to make them in a glass or ceramic bowl. My peas, my green beans, my California medley. Like, this is a great side. You know, frozen green beans is so easy. Kids like them. Like, that could easily be a staple. Now, canned foods are a little trickier because there is a legitimate concern about some of the chemicals in the packaging. Like, you might have heard of BPA being a concern, and now some of the companies are just substituting it for some similar chemical. Also, here's what I really want you to look at when you're buying canned food is I don't want a bunch of unhealthy additives in the food. So if you're getting canned pineapple, get the pineapple in juice and not the pineapple in syrup. And your canned pineapple it'll be great. Way better than like a cheese stick or a granola bar or something like that. So enjoy the canned pineapple. Enjoy your canned beans, but why don't you get the lower sodium canned beans? And maybe rinse them off a little bit. And they'll still be quite healthy. You can enjoy those beans just fine. Although I'll tell you what, if you make them from dry, not only are they a little healthier, but they taste better too. What's up with this paper towel thing on my slide? Well, let me tell you, we have a culinary medicine program where patients come in and they learn about nutrition and healthy cooking, hands-on. And so I supervise some of these programs, and I saw my chef fiddling with a paper towel in her greens, and it's like, what's up with that? And that's where I learned that now when I bring my greens home, because I eat a lot of greens, I'll have a handful and I'll put the paper towel in. It absorbs water, and you see water and heat lead to spoilage. And that paper towel will extend the lifespan of your greens by like 2 to 3 times. It's great. So that's a really cool habit for those of us eating greens, which should be everyone. Polyphenol oxidase, this is another tip for the plant-based pros, okay? So when I started eating healthier and I didn't want to have for breakfast, you know, like cold cereal, pancakes, and eggs and bacon and stuff like that. First, I started having a protein shake. And then I was like, well, I want to eat more whole food. I want to put some berries or something in here. And so I'd have berries and I'd have a banana. And it turns out a banana, it will make your smoothie creamy and delicious. But foods that turn brown have polyphenol oxidase, which breaks down some of these antioxidant polyphenols we want. And so now I usually do not include a banana in my berry smoothies. Maybe if I need the kids to eat a lot of it, I'll add a banana. But that's like next level for those of you looking to take it there. And my final thought I just want to add, as we're looking at these healthy foods, I want us to turn our excitement into action. And healthy eaters, they basically plan and shop and they do some cooking. You know, you invest in your healthy foods if you're going to eat healthy. And so let's circle back because, as we said, repetition is the mother of memory, which maybe repetition is the mother of memory is the only thing you're going to remember from our talk today. But just revisiting, okay, we're looking to add superfoods to your plate, to your bowl, to your snacks, right? Okay, so here's one last look here, and then we're going to look at some recipes. And so let me quick tell you about a patient. We'll call him Robert. This is someone who came back to me within the last year, and I was looking at his numbers before I went into the visit, and it's like, oh wow, his cholesterol's way better. He lost a bunch of weight. Like, wonder what happened. And so I go in and I said, you look great. What happened? Dr. Stephanoff, I just took your advice. That's all. And I look back to the chart. What the heck did I tell this guy? He says, you told me to eat soup, salad, and smoothies. I said, oh, that sounds like me. I love soup, salad, and smoothies. And he said, so do I. So these are dishes that is really easy to include lots of superfoods and high nutrient density bases. So like lentil soup with onions on it. That's amazing. This other picture, why does this other picture on the right look so janky? Well, it's because I took it. Okay, but here's the reason I included it. This is at our Butterworth cafeteria. So if there are any Corewell workers here, you can eat like this at Butterworth. On the left, I think that is like a power bowl, maybe with some shrimp and looks like there's bell peppers and cabbage. On the right is just a giant salad. Yeah, oh, I love a giant salad, and there's tomatoes and carrots and stuff. A couple oranges. And I had to take the photo from this angle so everyone could see that I'm drinking water and not Coca-Cola with this meal. A couple other little recipes and foods here just to get your appetite and your interest peaked. This salad, a couple things I like about this salad. One, if you've never had mustard in your salad and you like mustard, you're welcome. Secondly, look at all the great superfoods in here. There's kale, apples, carrots, onion, sunflower seeds. Like we're checking off like 3 or 4 G bombs right here. And by the way, mustard has vinegar in it. So giant salads with a whole bunch of stuff like this are a great choice. Tofu. Folks, if you have not had tofu, this is the month to do it, okay? I want you to put aside any sort of emotional prejudices you have about tofu. Tofu tastes good if you cook it well. And if you feed tofu to kids, they basically like tofu unless they're sugar addicts. So tofu is great. You should try tofu. And then here's your smoothie. Here's the other thing I like is oats. So I eat a lot of oats, but the important thing about oats is one, don't eat instant oats. Eat like a more whole oat. And two, don't put sugar in your oats. Put berries in. And berries taste awesome. So and they're amazingly healthy. So you can just add tons and tons of berries. You can't really add too many blueberries to your oats. So there's your oats and your smoothies right there, and you're off to the races. So wrapping up here. First off, I want to thank you for your time. And secondly, I hope that this month you can capture a lot of positive energy and excitement, that you can engage your intellect, your imagination, and just make this healthy food something that you look forward to and you want to eat. And the more you want to eat it, the easier it is to make it a lifelong habit. So enjoy these superfoods and all the nutrients and the health that comes with it. Thank you.
Thank you so much, Dr. Stephanoff. What an amazing presentation. I learned so much. It's so funny, every single time I listen to one of these presentations, I think I might know a lot of the things that you guys are going to talk about, but I continue to learn every single day. So appreciate that. I do have a few questions. Just pull those up. So the first one is, can you tell our audience when they're at the grocery store and looking at labels and things like that, any tips or tricks when looking at breads or tortillas and trying to find something that is appropriate in the fiber department?
Yes, very good. So first off, if you're going to be a healthy eater, you have to pay attention to that stuff. So the fact that you're looking at all is step one. Now, I personally, I like to look at ingredient lists, and I just hate having sugar in my food. So when I look at bread, I'm like, one, is it whole grain? Two, is there sugar added to it? Now there's a different way to approach this issue, which is, and maybe you'll remember this better than me, Kara, there's like a fiber ratio that our dietitians like to recommend. So basically you want more fiber and less other carbs, and the higher that ratio is, the better. If you don't mind me recommending a brand, I like Ezekiel bread because it's sprouted grains and lentils, and there's no salt, oil, or sugar added to it. And you'll find that in the frozen section. although it's not cheap. And when it comes to my kids, if we're not giving them Ezekiel bread, we're just trying to get like a whole grain bread with less added sugar. And I like to get the thin slice too.
Yeah, I love that. I think it's 5 to 1, the ratio. So 5 grams of carb to every 1 gram of fiber is what you want. I could be wrong on that, but I'm pretty sure that that's the ratio. Does that sound right to you?
Yeah, it's 4 or 5, but the
Or
bottom line is you want more fiber and less other carbs.
yeah, for sure. Okay, another question. For individuals looking to be more plant forward or plant-based, you mentioned B12, vitamin D. Do you have a specific brand that you recommend, or should they just go to their local store and kind of pick any B12 or vitamin D that they see on the shelf?
Oh, I need to give my financial disclosures here that I'm not invested in any of these companies. Yeah, I get asked this all the time, so thank you for asking, Kara. First and foremost, it is definitely worth noting that when it comes to vitamins and supplements, studies on the quality of these supplements show that there's a reliability problem. And it's common that a supplement will not have what it says it has, and certainly not at the dose it might. And so, first off, if you're getting any brand, it should be tested by some third party, and there will be like a consumer testing label on it. And there's a few different ones that the companies can get. Personally, I like the drfurman.com stuff. I mentioned Dr. Furman earlier, so I've got a little bit of affection for him and his stuff. My wife takes Nordic Naturals. I know a lot of people at the Lifestyle Clinic, they take Complement. So any of those high quality brands with third party testing will be good. And I mentioned a few of the vitamins in particular that I want to see in your multivitamins. So look for the third party label and look also for iodine, zinc, vitamin D, and vitamin B12. And if you get the Dr. Furman one, then it'll have all that stuff.
Awesome, thank you. Yeah, I know Dr. Furman has a great prenatal as well. And I appreciated you calling out things with pregnancy in the presentation. So
you're welcome. I bet his prenatal doesn't have folic acid.
I'm not sure.
I bet it has folate.
Yeah, I'm sure you're right. Okay, one last question and then we'll wrap up. I think this is a good one. So there's so much out there on social media around supplements, protein, things that can maybe help with bloating or other things like that, retaining water. When people are trying to find a source of truth, just should try to wade through all of the content that they're seeing every day. What is your recommendation on where to look or find the best information? Do you have places that you typically go to when you hear something, or is there a place for protein powders or things like that? I guess in the same vein, what are your thoughts on that?
Well, there's really two questions here. One is, I'll answer the easier question first. Is there a place for protein powders? Yes, but it depends on your situation. If someone is trying to gain weight and muscle mass, and especially if they have a low appetite or digestive issue, protein powders can be useful. For most people, we have a problem controlling our weight, and so protein powders will be dangerous because it'll put us at risk of overeating macronutrients. Now, so generally speaking, it depends when it comes to stuff like that, like this or that nutrient. Now, the other question is, how do you learn from a reliable source about nutrition, given the fact that there's disagreement between well-credentialed people? And I'll answer that in two parts. Number one, I want the typical patient to focus on the stuff for which there is no disagreement. Like, fruits and vegetables are healthy. Eat lots of fruits and vegetables. Whole foods are healthier than processed foods. Eat whole foods. There's no disagreement about whether sugar is healthy or not, or whether berries are healthy or not. So you can always eat the best stuff. Secondly, well, if you're not sure, come to the lifestyle clinic and I'll tell you, or one of the other experts here. When I am asking a question like that, I will often go to nutritionfacts.org first. This is a very approachable resource that has good scientific quality. And Dr. Greger, the physician who runs as a nonprofit, nutritionfacts.org, you can look up eggs or vitamin C or whatever, and he'll show you actual studies. He'll talk about it in plain language, and there's no question about whether it's fact or not, because the studies are right there. You know, I was recommended to some expert recently by just some random stranger, making some specious claim about like nicotine or something. And when I looked up the expert that she recommended, it was a lot of speculation and hypotheticals and not a lot of facts. And so I found it not convincing. And so being a doctor, at least I can turn to the actual science and evaluate the claims. I think that's hard for a typical layperson to do. And so it helps to have an expert that you really trust. Well, us at the clinic, we're willing to be that for you if you like.
Awesome. Well, thank you so much. Thank you again for the wonderful presentation. So much great information. And thank you for everybody who joined us today. A few quick reminders as you continue on the Plant Power Challenge journey. Keep exploring in the kitchen. So each week brings new nutrition challenges and cooking demos designed to boost your confidence and creativity with whole plant-based foods. If you missed a webinar at any time, no problem. Every session is recorded and linked in Monday's email, so you can catch up anytime on anything you might have missed, or rewatch if you are forgetting something that one of the presenters mentioned. And just a little reminder that you're really part of something powerful here. So thousands of others are on this journey with you, planting seeds for lasting health and discovering the benefits of whole food, plant-based lifestyle. So stay curious and stay motivated, whether you're trying one new recipe or rethinking your plate entirely, thinking about totally changing your lifestyle or coming to our practice for a little bit of support and help. So thank you so much again for joining us today. Your commitment is what makes this challenge so impactful, and we hope to see you on the next presentation.